If you're a newlywed and you're thinking about having your first child, it's really important that you consider health insurance before you do, because getting pregnant will not give you a special enrollment period into the marketplace outside of the open enrollment times. So you'll need to have coverages before you actually get pregnant in order to be able to take full advantage of all the maternity and labor coverages and benefits that are available through marketplace health insurance. If you're already in marketplace insurance but are planning to get pregnant, it's important that you look at your policy and make sure that you have good labor and maternity coverages and benefits. And even though every policy in the marketplace has to have a minimum amount of labor and maternity coverages, they could all be very different. For example, a high deductible insurance policy is not ideal if you're planning on having a baby. And the reason for it is, if you have a deductible that's $7,000 or $8,000, you're gonna need to pay medical bills or labor and delivery up to $8,000 to meet your deductible before the insurance even starts covering any of those bills with you. You can also find policies in the marketplace that will cap you out at $500 or $1,000 all in for labor and delivery. These policies will cost more per month, but obviously if you're planning on having a baby, it's a big expense. And most of the times, once you calculate what you would pay in additional premiums every month to have a very low out-of-pocket when you give birth, it's gonna make a lot more sense to spend that extra money every month than it is to have a lower premium, and then when you do have the baby, have to come up with a lot more money to meet your deductibles. Keep in mind, it depends on the state, but most states, when you enter your information, you're gonna have dozens and dozens of options to go through. How do you know what policy is going to give you the best coverages? It could take you hours to go through all the policies that are available that pertain to labor and maternity or have better coverages. I know this because we have 2 children. And when we had our first child, I spent hours going through every single policy that was available to us in the marketplace. I calculated it down to the pennies, what each one of these options would cost us, and I was able to find the best coverage for us for labor and maternity. And I'm in insurance. Can you imagine somebody who's not navigating through literally the dozens and hundreds of policies that are available for you in the marketplace? That's what I'm here for. That's the service that I provide to each and every one of my customers. I identify what you need by asking you questions, and then I apply my experience and my education to help find you the exact policy that will fit your family's needs specifically. So, if you're thinking about having a baby, health insurance is very important. Click the link in my bio, go through it. You can book a call. You can ask questions and send me a message. You can go directly onto my portal and get a quote for yourself if you feel you want to try that. I highly recommend book a call with me. Spend the 10 or 15 minutes. Let me give you a good assessment and at least point you in the right direction. Are you leaving an employer that you've been with for a really long time and has provided you with health insurance? If so, here's what you need to know. Number 1, you have 30 days from the moment you lose coverage with your employer to enter the marketplace and find yourself health insurance. This is known as a special enrollment period, SEP. You can use COBRA, which was a program designed to help extend your health insurance benefits once you leave an employer, but that could literally cost a mortgage payment every month. 9 out of 10 times, marketplace health insurance will be a much more affordable option than using COBRA to extend your healthcare benefits. It's important to have an agent that understands special enrollment periods and how to properly set you up for marketplace insurance.